back muscles, and we learn shoulder muscles. Correct?
Yes.
Okay. Can you name the muscles here?
Brachialis.
Loud.
Bicep brachialis.
And bicep.
Bicep long head.
Okay. Bicep, long head, and
Bicep.
okay. It's okay. Tell. If you don't know, tell. I don't know.
Bicep brachialis.
Biceps brachii.
Brachialis.
Brachialis.
Biceps brachialis, long head and short head.
Long head,
Short head.
short head. Okay. This is a further division of this. Triceps, no?
Triceps में
Lateral.
lateral head triceps
Lateral head.
Long head, lateral head.
and the short medius
Medius.
medial
Medial. Long, lateral and medial. ठीक है? Here. In the back, what all did we learn?
trapezius rhomboid infraspinatus
Rhomboid.
rhomboid major and minor
Rhomboid, major and minor. Next,
scapula
that is the fourth. There is major, minor. Okay, that comes in this topic.
shoulder
What is the pillar?
1 minute serratus superior inferior serratus superior inferior posterior inferior serratus posterior
Serratus
posterior inferior
Posterior interior.
posterior inferior. And the breast. Can you name another muscle that we learned last week? Only the breast was there. You are not there, so you won't know. We covered only few muscles last week. So I'm asking only those muscle names. Do you remember?
levator
Levator,
scapula
scapulae. This is the topic we were supposed to talk about injuries. Okay, in shoulders, what did we learn?
in shoulder like deltoids posterior
Posterior,
lateral and
Lateral and anterior.
anterior and the rotator cuff so it will
rotator cuff. What did we learn?
okay in rotator cuff teres major teres minor
There is
major teres minor
There's an abbreviation he told.
CAS.
clavicular
Yeah, clavicle aereo.
That is for shoulder.
shoulder
For deltoid. he told.
SITS
For rotator cuff, he told shortcut to remember.
SI
SIT.
SITS
SIT.
Six. What is it? S stands for
supraspinatus
what?
supraspinatus
Supraspinatus.
infraspinatus
Spinatus.
okay infraspinatus
Infraspinatus.
teres minor and
Teres
minor subscapularis
scapularis. These are the muscles we learned last week. Okay. So the shoulder is made up of
deltoids
deltoids and
Rotator.
rotator cuff muscles, right? There are two major groups of muscle which make a shoulder.
So you want to
Oh yeah. The two major. So basically today I am going to speak. Hi, my name is Syed Jameel. I am going to speak about shoulder related injuries. So today I am going to take up a part of the shoulder related injuries. Yeah, not the entire, because the topic is vast and the time is less, and it's quite complicated if we don't work on one. So what will I cover? The name of muscles which can cause an injury or which can be injured. That is one thing. Second thing I am going to cover is how do I diagnose the problem? How do I find out what is the problem in the shoulder? Third is rehabilitation. Okay. So in the shoulder there are two group of muscles which form the shoulder to move up, down, right, left, right. It's a very complicated muscle area, and it's phenomenal. The way the shoulder works is amazing. Now, what are the two group of muscles? Deltoids and rotator cuff. So today we will talk about rotator cuff. So rotator cuff muscles. Now there are four muscles that are made up, when they are clubbed together they are called as rotator cuff. Four muscles. What are they? Supraspinatus, infraspinatus, teres minor, sub. Why is it called subscapularis?
because of the cuff of the scapula.
Come. Today I will demonstrate where exactly the problem can be. Please remove your shirt. What? This is a training. This is how you will learn. Believe me, you will love this. Remove. Nothing will happen. Please don't mind. Your body is not good. Huh? You've got an amazing body, man. Or we can call Azib. Azib strip blasting. Don't flex your muscles. You are not showing your chest. You're only looking at the back. So rotator cuff is a group of muscle which is there on your shoulder blade. Deltoid. Sorry, this is deltoid. This is scapula, the bone which goes like this is called scapula. Now on your scapula, if you touch here, there's a bony part, right, which is standing out. What is that called?
The spine of the scapula.
Perfect. On the scapula, there's a bone like this. So this is the scapula, the bone is standing out, right? If you see that bone runs like this, you can touch it and feel it. That's the spine of the scapula. On top, with the muscle which is there on top of the scapula is called, what is it called? No, supraspinatus. Perfect. So this is the supraspinatus. After the spine, below that, there are three muscles. What are those three muscles? Infraspinatus and teres minor. Sorry, the two muscles below the spine of the scapula. Infraspinatus and, so can you open the picture of scapula? Can you show your scapula? No, you need to do like this. Get your scapula out. You can't get your scapula out. That is bad. Like this. Raise it. So basically, this is where his scapula is. So somewhat like this it is. Okay, done. So this is the spine of the scapula. This is the spine of the scapula. Okay, this is the supraspinatus. This is the infra, I think this is big. This is infra and teres minor. This is infraspinatus and teres minor. He's laughing. Now, where is subscapularis? Release, relax, relax. Where is subscapularis? This is the scapula. ಅದರ ಮೇಲೆ ಈ ಮಸಲ್ಸ್ ಮೂರು ಮಸಲ್ಸ್ ಇದೆ. Where is subscapularis? It is behind this. This is a scapula. Give me your book. Any? Fossa. Fossa. So if this is the scapula, subscapularis is sticking inside.
The anterior part of scapula.
Yes. From here if you see it's anterior. Okay. From there if you see this is anterior. That is posterior. Subscapularis something. Fossa. So these are the four muscles in the scapula. Most of the muscles, now what are these muscles function? The function of these muscles is to hold the shoulder. It's connected to this bone. So these are all, they have tendons. So these come and connect like this. The tendons hold like this. Okay. So they are trying to keep the shoulder intact without dislocating. So they are not letting the shoulder go out of range of motion. Now when does the injury happen? When this hand goes beyond range of motion too much without training or without practice, or he falls on this hand, or repetitive movement of the same activity. Now who does that repetitive movement of the same activity? Can you name some people? Swimmers, baseball, golfers, badminton, bowlers, somebody working, mason workers, they're doing this, they're taking the cement, or plumber, carpenters. So any repetitive movement can cause wear and tear in this tendon. Now most of the time you don't need a surgery if one of these tendons have inflamed or slight tear is there. Now there are two kinds of tears in this tendon. One is a very minor, mild tear. One is a deep tear. Even in the deep tear, many times people can recover without surgery if they give it rest. If they don't do massages, RIC. So if they don't do massages, if they don't try to, experiment with different exercises, most of the times when there is an injury, pain in the shoulder, it is the supraspinatus which could be causing the pain. Now what is supraspinatus done? Supraspinatus has become tight, or the tendon has inflamed. Inflammation means swelling.
This is tear.
Yeah. So now for the supraspinatus, the muscle comes from behind and it connects to this bone. It connects here, it holds here. Okay. So if it is supraspinatus, it comes here and it holds this bone like this. This ligament, that muscle, tendon, What is a tendon?
Which connects the bone to
Muscle to the bone. Ligament is bone to bone. Holding two bones together is the job of ligament. Holding muscle to bone is the job of tendon. Correct. So the muscle from behind.
there is no ligament here. We don't have a ligament.
You don't have a ligament. This shoulder bone is sitting in this glenoid fascia. So it's sitting just with the suction, and there are ligament tendons which are coming and holding it. So there are many ligaments of different muscles holding, like this bicep muscle. You see, it's going here, and there's a small cavity here, like a groove. So it's going from the arm, and it is holding this bone. Then from the rotator cuff, the muscles are coming and holding the humerus. So like this, there are many muscles going here and there and holding each other. But there is no ligament between these two bones. Between the, now where is this bone sitting? Where is this bone sitting? What is that bone called? Which, a part of what is that? Scapula.
Scapula's supraglenoid cavity.
Yeah, so in this cavity belongs to scapula. The scapula is quite a big bone. Okay. So the scapula, did you understand? Did you know that? You didn't know that? ಅರ್ಥ ಆಯ್ತಾ? ಗೊತ್ತಾಗಿಲ್ಲ. ಓಕೆ. ಸೊ ಸ್ಕ್ಯಾಪ್ಯುಲಾ ಅಂದರೆ ಗೊತ್ತಾ? ಯಾವುದು? ಹಿಂದ್ಗಡೆ. ಸೊ ಸ್ಕ್ಯಾಪ್ಯುಲಾ ಬಂದ್ಬಿಟ್ಟು ಹಿಂಗಿದೆ ಅಲ್ವಾ? ಸೊ ಇದು ಆ್ಯಕ್ಚುಲಿ ಇದ್ರ ಜೊತೆ ಇಲ್ಲಿ ಬಂದ್ಬಿಟ್ಟು ಒಂದು ಓಪನಿಂಗ್ ಇದೆ ಈ ಥರ. ಇದರಲ್ಲಿ ನಮ್ಮ ಕೈ ಕೂತಿರೋದು. This is your arm, humerus bone. This is sitting in the scapula. This is the scapula. It has a socket like this. So it is sitting like this in the scapula. Okay. Now this has a white colored cushion in this. You know, you have seen these on the wall you stick with the air, that suction. Hangers, or on the car windshield to keep the mobile, you stick that, no? That white color suction. That is like this. So this humerus bone is sitting inside. Now how is it sitting inside? There are muscles of the bicep which have a tendon which goes like this and holds on the scapula. Then from the scapula, all the subscapularis, teres major, teres minor, infraspinatus, all that, they have tendons which all come together and they are holding this bone again. Okay? On the humerus. So that is how this is sitting here. Otherwise it will fall off. Something has to hold it, no? Only suction cannot hold it. If suction was holding it, somebody pulls suddenly, it will come out. So now when Anis had a shoulder dislocation day before yesterday, this bone came out and it went off here.
But there was no tendon tear or something?
No.
Nothing was there.
We will know later on when we do the X-ray. When we do MRI, not X-ray. In X-ray, you can't find out tendon tear. Now, what happens? These tendons, which are supposed to be here, they are getting extended to come down here. And this bicep tendon, which is supposed to be holding here, now it has to pull down. So that causes crazy pain. That pain is unbearable. The pain is unbearable because the body is telling, put it back soon. Okay? So now coming back to the topic, I am deviating. supraspinatus, which is the upper part of the shoulder blade. How do I find out if that is a problem? The simple exercises. So can you come here, Srinivas? So now we are doing the diagnosis. Diagnosis. What is diagnosis? Trying to find out where the problem lies. Right? So you will hold like this, go up, turn, make as though you're holding a can or something. Okay. Now hold it like that. Bring it a little forward. Both the hands. Not so much. About 45 degrees. Now try to press up. You have any pain? No. So he is able to press. If he had, okay, stand here. Do that. So if he had an injury in his supraspinatus here, if the problem was from here, then I can just with my 2 fingers push it down. Now you try to resist. I'll push it down, you have to hold. So I can't push it down. Pretty strong. There's no injury. If he has injury on the left side, this hand will go down. If he has injury on the right side, this hand will go down. If he has injuries, if both are weak, both will go down. So that is one way of diagnosing it. Simple. So you know what to do for this, right? So tomorrow when you get a client who has shoulder pain, don't worry ma'am, let's do a test. Okay. Absolutely. See, you have to remember, you have to use that word with the client. Let's try to find out. What will you say? Let's? Yes. Why are you saying this word, let's try to find out? Why are you not telling, I will find out? Why are we saying let's try?
Because even we are trying.
Exactly. Because you are not doctors. You are not orthopedic surgeon or physiotherapist. You are a trainer. Your job is to train. Your job is not to diagnose a problem, give medicine. No. I will try to help you by trying to find out, try to diagnose. Disclaimer. That's called disclaimer. You have to save your ass always. That is one thing. Now coming to infraspinatus. I left one of my sheets outside. Okay. Coming to infraspinatus and teres minor. These both have pretty similar way of finding out the problem. So you can hold your hand closer by, come here. Okay. So this is one way. Turn towards me. Try to stick your elbows in and push me out. I will push you in. Pretty strong. Keep your elbows inside. So pretty strong. So if he had an injury because of teres minor or infraspinatus, his hands will go in. Either this will go in or this will go in. So if this guy has an injury here, so this hand will not be able to resist. So you have to tell him, okay, do you feel the pain now? No. Do you feel any pain? No. Okay. That means it's fine. Okay. Subscapular. So any doubt on this? Imran, get me one sheet. I have kept one sheet written on the desk. I have written some names of exercises. Okay. So did you understand, Safura? Subscapularis. See, it will take time for you to remember the names, but it's okay. But at least you can keep listening to the words. Was this helpful?
Yes.
Right? It's amazing, right? Because you get shoulder injuries every day in the gym.
Even in this, do we have a tendonitis?
Definitely you have.
Yes.
So this is, see, when you say injury, the injury will always be either to do with the bone, muscle, nerve, tendon or ligament. These are the only few things that you can do. Okay. Now coming to subscapularis. Now if it is subscapularis, can you keep your hands like this? So, hold your hand like this, keep it back, try to push it out. Do you have pain? I have pain. You have pain? Okay.
You have to push it
No, no, no. Leave it loose, leave it loose. Don't push, don't push. Leave it loose. Relax, relax, relax. Okay, I'll just hold it back. Try to. Okay. Now you have to try to create a gap here. Can you create a gap between your hand? Do you see? It's difficult. Do you see it's difficult? You know why? Because your scapula is trying to stick back. Your scapula is supposed, you got a catch? Even I got a catch. So, yes, come here. So turn, do this. Create a gap. Do you see this gap? Okay, now I will push and you are supposed to push me back. Do you have pain? No? So his subscapularis is pretty good. Push.
Try this one, I had this one.
So push. Okay. Here. So this is also pretty strong. Yeah? Come, Imran. Come. Do this with the other hand. Turn. So try to create a gap here.
How can I make out, like, if I do like that,
Little up.
I'm getting a contraction on my scapula.
You will get a contraction. It's paining? Okay. Come here. Tell me, what are you getting? Where are you getting? Here?
Yeah, scapula.
Yes, you will get a contraction because your leave this loose. Your scapula is stuck to the rib cage. You are trying to push it out when you do this. Why? Because beneath that is your subscapularis. One easy way to release the subscapularis if it is stuck is put your hand in and pull it out. That's one of the ways. So this is one of the ways.
Yeah, Glenn needs to do this.
Okay.
But you don't do this to the clients, for God's sake. Especially don't do it to the lady clients. So if you have pain in the shoulder, you can actually do this. So how do you find out this? Do you see this coming up? If you push from here, hold. See coming up? Leave it loose. This muscle this bone is stuck, and there's a muscle inside that is called subscapularis. Got it? Try that. Try this.
Subscapularis is in the top, right here.
That's supra.
This.
Sub is inside. Okay, now push.
This is like a confusion.
Okay, good. Pretty good. You have pain? No? Okay, good. This hand? Pretty decent. That hand is stronger. That's because he's a right-handed guy. Right? Try my this one. Just hold it. You don't have to push. So mine is weak. I'm not able to push. My subscapularis is weak. So I do get shoulder pain actually. Can you hold that again? See, I'm not able to lift it up. That means my shoulder blade is stuck. I have to release it. No. I generally cannot push my hand back. I get pain. My tricep is paining when I do that. So my subscapularis is weak. Now how do I, so that's the diagnosis part. Understood? Clear? Sit down. Understood? Clear? Today you will go home and try this on Nabil. Don't break his shoulder. Don't break his shoulder and tell, sorry, this is what they taught me. Okay? Cool. Coming back to, so this is done. Names are done, diagnosis is done. Now, what is the rehabilitation that we have to do? Okay. Now, for your supraspinatus, most of the rehabilitation for all these muscles are very close to each other. They are very easy and you can all remember it, and you can do one workout that will affect the other muscle as well. So all the rotations, external rotations, lying down on the floor, holding a half kg dumbbell and lifting up and down, or going forward and backward, all that is to do with your group of muscles, rotator cuff muscles. Or lying on the bed and lifting your hands, or lying down on the floor and lifting, making a Y, or putting an inclined bench, putting a chest on the bench and holding very light dumbbells like 1 kg or 2 kgs and trying to lift. All that is rotator cuff exercises. Even putting your head on the bench, standing like this, holding a kettlebell and rotating, that will work.
Just like
Rotation. Now you want to release your subscapularis. Keep a Smith machine, take a tennis ball, keep the tennis ball under your armpit, take a half kg or 1 kg dumbbell. You try it first, don't give it to the clients. Never just give exercise to the client without you trying it. Keep it and try to work. Even if the shoulder is stuck, you'll start releasing the shoulder. Okay? So there are multiple exercises. You just have to remember external, internal, raising up hands, sleeping down and raising up hands, rotation, or doing lying down and just picking up half or 1 kg dumbbells, 2 kgs dumbbell, doing this. All that will work your rotator cuff muscles.
to do that Y, I, and
Yes.
T.
Yes. The Y's are for your rotator cuff.
So what is the average Y, I?
I don't know. I'll find that out. Question is Y, I, E. Right? W.
V.
Okay. I'll find that out. Okay? So,
If you do this exercises in how many days?
okay, now remember when should I do these rehabilitation exercises? When the patient has pain, or when the patient's pain has come down at least by 75%.
It has come down and we have to still
How will the pain come down?
rest.
Rest. And other than medicine, what else can you do? Icing? Icing? Not really. I don't suggest, because people don't know how to massage. So you don't know which muscle you're, probably inflammation is there and you're rubbing it and inflammation is becoming more. So when the muscle is tight, when it is tight, you have to massage reverse to release it. So if you are pushing from like this, you're probably making it more tight. It's compressing. And if you are by mistake massaging the tendon which is already inflamed, then you are causing more harm. So best part is give it rest. If your client has a PT client who's injured the shoulder, avoid exercises which are above shoulder. First let them recover. Then you go for all those things.
Recover time is 3 weeks is what?
Depends. It depends on nutrition, rest, their job, what profile they are in. So if they are in a profile where they have to work with a lot of hand movements, then you have to think. If you are a trainer and you have the injury, what should you do? You should avoid exercises. You should tell the client, I cannot support you over the shoulder exercises. You have to avoid those kind of exercises. Yeah. The best thing to do in injury is avoid exercise for that particular movement which can cause the injury. And in this kind of injury, mostly above the head movements like a military press, Arnold press will cause the injury.
So when I do some heavier dumbbell presses, bench press or dumbbell press, I will get pain over here. When I do this external rotation, it will get
Healed. So Is it the pain there, or is this the pain due to rotator cuff muscles being weak?
It's a pain.
It's not a rotator cuff. So which muscle is that? Now diagnose the problem and tell me where is the problem. So find out where the problem is. Okay, research about it. So this is how you learn.
I get a like pain in this area. This
What is there in that area? Huh?
deltoid.
Okay. So is it a deltoid pain? So what is it?
Yes, I said what is it?
The joints are there, the tendons, the gutta.
So find out. Okay, cool. So you have to go read, open the anatomy website, see what are the muscles that side, go research, see if that is the cause, then try it out and see if the pain happens again. Yes, it happens. Then what should I do? Okay, cool. That's it about the topic. There are a lot of stretches for your scapula. Like you can take a stick, that stick, and you can do this. You can press up, left, then right, then back. So you can do those kind of stretches and warm up. You can go to a wall, keep your hand to the wall here, and you can try to push slowly without injuring this to release the subscapularis. You can do this, but don't injure in the way trying to stretch more. Don't try to injure yourself. Yeah, cool. That's it. Thank you very much. My topic is done. Yes, questions?
I have a question not related to this topic.